In this video, we're going to look at some of the clinical features of cystic fibrosis. As you'll remember, cystic fibrosis is a genetic disorder with an autosomal recessive inheritance. It's estimated that 1 in 30 people in the UK are carriers for cystic fibrosis, and the incidence is around 1 in 2,500 live births. Although it's mainly thought of as a respiratory disorder, it is multi-system, affecting the heart, gastrointestinal system, the hepatobiliary tree, and the pancreas, as well as others. Let's start with looking at the lungs. You'll remember that patients with cystic fibrosis have very thick mucus layer and impaired mucociliary clearance. This means it's very easy for bacteria to develop and take hold in the lungs. So recurrent bacterial infection is common. Sometimes patients are colonised and it's very difficult to eradicate these infections. You may see children who are in for prolonged courses of antibiotics to try and get rid of some of this bacterial infection. Infection with Aspergillus can lead to a condition called allergic bronchopulmonary aspergillosis, and this occurs in around 10% of patients. It's a hypersensitivity reaction to the Aspergillus, so there's a very high level of eosinophils, IgE and IgG. The lungs respond by developing a hypersensitivity reaction, and this results in wheeze. The problem with both infection and ABPA is that they promote the development of bronchiectasis and eventually respiratory failure. Air exchange is impaired, and this is associated with pulmonary hypertension. As you remember, the heart and lungs are intimately connected, so as pulmonary hypertension develops, the strain increases on the right side of the heart. Over time, this becomes hypertrophied, and eventually, right ventricular failure, cor pulmonale, develops. The GI tract is also affected in cystic fibrosis. Some patients are born with atresias, and you may have seen this on the neonatal unit. There can also be obstructions in the GI tract. As a neonate, this may present as a meconium ileus. In children, this is the distal intestinal obstruction syndrome. The hepatobiliary tree and the pancreas are both affected. In the liver, fatty liver and cholestasis can take place. There is biliary cirrhosis, and biliary stones and colic can also occur. Eventually, the liver becomes cirrhotic and its function is impaired. In the pancreas, both endocrine and exocrine functions are reduced. Loss of the endocrine function, insulin production, leads to diabetes. Loss of the exocrine function results in steatorrhea following on from malabsorption, and this in turn results in impaired growth, so that children with cystic fibrosis have failure to thrive. Infertility is also an issue. Males have azoospermia sometimes. Females may also experience difficulties in conceiving. Some patients suffer with arthritis. So although this looks like a respiratory disorder, remember that many different systems are affected. Treatments are aimed primarily at preventing complications from this. So recurrent courses of antibiotics to prevent the development of bacterial infections which can lead to bronchiectasis. Preventing bronchiectasis then also relieves the pressure on the heart. Children are encouraged to drink lots of fluids to maintain passage through the GI tract, although you may see that some neonates have required surgery as a result of meconium ileus. And replacing some of the functions of the pancreas, so by taking enzymes which aid malabsorption or using insulin, may also be seen.